Welcome to Friday. Welcome to KUOW's Week in Review, where we get together to assess the week. And by get together, I mean stay apart. We are social distancing because of coronavirus. My guests are teleconferencing. Allison Williams, deputy editor at Seattle Met Magazine. Can you hear me okay?
I can hear you.
Welcome.
Thank you.
Charles Mudede, writer at The Stranger. Do we have you, Charles?
You got me. I'm here.
Very good. DJ Wilson, publisher and writer at the Washington State Wire and State of Reform. DJ, hello.
Hey, good afternoon.
Thanks to all of you for not dropping by, and thanks to everyone for listening. Let's begin. Nearly 40 million people in California and 20 million in New York State are now required to stay at home. New York says non-compliance may result in fines or summonses. This is a step further than we've gone in Washington. Here is Governor Jay Inslee not mandating a shelter in place, but urging it.
If we are living a normal life right now, we're just not doing our job as Washingtonians. It's much, much too dangerous. We can't do that anymore. We need to make changes to our personal and family lives, regardless of size.
Governor Inslee has prohibited gatherings of more than 50 people and issued guidelines for gatherings of fewer than 50. You're still allowed to leave your home, but why would you?
Now, those of us who are under 60 and are healthy, do not have underlying conditions, you ought to look at your life and figure what is really required for my family's health or general living. And if the answer is you really don't have to do it, stay home. You just got to stay home unless it's absolutely necessary to go out.
And here's how King County Executive Dow Constantine describes sheltering in place.
You don't have to just stay cooped up in your home. Walks are okay. Going for a bike ride's okay. Going for a run is okay. It's even okay to go for a short drive as long as you don't go so far away that you have to stop and use a public restroom.
And that is not untrue in New York and California. Their websites say stay home, but when reporters ask, officials are saying you can take a walk. My guests, is there any effective difference between Washington, California, New York right now? Anybody want to begin?
Well, I'll jump in. I think there's quite a bit of difference. I think the difference between an order like the one Gavin Newsom offered in California, where the entire state of 40 million people are directed to shelter in place, I think that's significantly different than what we have here, where I think we're effectively sheltering in place because we're smart as Washingtonians, and we know that that's good for our community and public health, particularly of our seniors. But if you go to the grocery store, you're not going to get a stink eye from somebody telling you should go home. And if you have to go take your dog to the veterinarian or something, you're not going to get a side glance. So we still have considerable flexibility here, for better or for worse, in Washington State that are no longer afforded in California.
Yeah, and there's also another thing is that we were just a little bit ahead. I mean, I think right now California is realizing that it didn't act earlier, and so they have to. The measures are going to have to be a little more dramatic than, or at least to get the public there a sense of how serious the situation is. I don't think it's so much like these. It's not so much like these restrictions work physically. It's more like they work mentally, because it makes people understand what is going on. And I think mentally in Seattle, we've been dealing with this a little bit longer and adjusting our habits for a little bit longer than other places. And I still think there's a lot of room for improvement. But in general, if there's going to be a city, I think, and I did hear somebody Dr. Jonathan Golub, who now is at Michigan, but used to work here at University of Washington. He's under the impression that in the near future, if there's going to be a bend in the curve, it's more likely going to take place in Seattle than other places. And this is not just simply just to make Seattleites happy. It's only because we were fortunate enough to be alarmed early. And the streets were emptied earlier than other places. And so we were called a ghost town by Wall Street
right.
before other nobody knew that that was the future for other places. So
Yeah.
that's why I think things stand.
Allison?
Yeah. Well, I think the difference right now is we don't have as much consistency in Washington. A lot of us have been, de facto sheltering in place for a week or more, and we just didn't necessarily call it that, where there are people maybe across the state that are living practically normal lives right now. So I think maybe the difference is that recognition, that coining a phrase to let everyone know that they're on the same page.
Mhm.
Whereas I see most of Seattle is very much operating in a shelter in place kind of situation. Well, that might not be true across the rest of the state.
I have heard reports of, hey, this park is too busy. This pickup basketball game shouldn't be going on. Part of that's been the weather. 60 degrees and sunny in mid-March in Seattle is hard to resist even now. So maybe it's good news that it's about to get chilly and rainy again, unless you don't have a warm, dry place to get to.
Absolutely.
Yeah, but my impression, and I do walk around. You do minimize how you get around and stuff and so on. But I have seen in parks, it's usually young people, and so you have to go and tell them. We have to figure out how to tell young people it really is this serious.
Yeah,
I don't see a lot of adults so far. I might be wrong about that. I don't see many adults doing that sort of thing.
I saw a piece in the Seattle Times about the generational divide. The Times reporter was skeptically describing the popular theory that boomers tend to downplay the threat, millennials tend to be unwilling or unable to stay away from crowds, and Gen Xers, quote, the latchkey kids of the 80s and 90s are uniquely qualified for social distancing. In their youth, they spent hours alone in their rooms watching after-school specials, doing homework, making mixtapes for their friends. To this day, they're perfectly content, holed up at home and finding ways to entertain themselves.
I wouldn't say latch kids. I'd say something like AIDS. Might have been the advantage that we have when we came, because I've noticed that a lot of young people are like, complaining about spring break and so forth and so on. And when Gen Xers were coming into their own moment of sexual, excitement and development, we were told we can't do anything because we're going to die.
Right.
And so, yeah. I really do believe that plays a big part with Gen Xers. We actually were confronted with a virus, and we sort of been there and and we know what it means to suddenly do things that are unusual unusual in terms of social patterns, such as using condoms, being safe and so on and so on. And I think that would be more, I think that would be more of in line with Gen X behavior.
DJ, sorry, go ahead, Allison.
Well, I was going to say, I was out in a park yesterday with my sort of quarantine buddy, and we were staying far away from everyone else and seeing small groups of people isolated from other people. But one thing about that generational change is older people might be more likely to have kids that they're at home with their small nuclear family, whereas some younger people, they're on their own completely. And so they're seeing maybe the small gathering of 2 or 3 people in a park as their nuclear family. And I think as we define what staying at home with your family means, that might be a little different for people who are in maybe, have a spouse and a couple of kids at home versus someone living alone and is trying to figure out where the boundaries are for them.
DJ, what do you think of how Governor Inslee's been handling this crisis so far?
I've talked to a lot of folks on this question, Democrat, Republican, public sector, private sector, folks outside of Washington State looking in for guidance on how to move their communities through this process. And uniquely and unequivocally across the board, people give Governor Inslee really high marks. I actually think he's particularly well suited for this kind of moment. I've been a little critical of him in some of my comments is that he doesn't yet have a real vision for his 3rd term. I think that is still accurate. His website doesn't have anything on it except for a donation page. But I've also said it's sort of sophomoric on my part to be looking for policy vision when we're in the middle of crisis execution and crisis management. And on this moment in crisis management, I think he's just very, very effective. He's a very good team leader. I think we see that in the way that he has marshaled his agency leaders, both in terms of action in terms of government, but also communication. I think has been very incremental, where you see places like California and New York slow to act and then act big, sort of broadly and aggressively. Governor Inslee has implemented these sort of incremental approaches, and I think that has been really meaningfully effective, both in terms of educating people and raising our awareness, not to scare us, but raising our awareness so that we can act on our own, but also in mobilizing Washington state government to be supportive. I think he's doing a really good job.
You mean gradually ratcheting up restrictions and closures? You think that's worked to help people get acclimated or feel less panicked or be more compliant?
Yeah, I think so. I mean, and in some cases that was really good. In some cases it was he needed to course correct a little bit. So, for instance, we'll recall that he first issued a school closure order for King, Pierce, and Snohomish counties, left the other parts of the state relatively. I mean, didn't change the other parts of the state in terms of school closures. He then, I think, 2 days later, expanded that to the rest of the state, doing so because the challenge of having a piecemeal approach in terms of crisis management was just an unnecessary burden in terms of government administration. But his instinct was to move gradually and slowly. And I think that you see that on things like, being down to 50, a ban of gatherings of 50 people or more, but not yet below 50. Whereas he's still nevertheless saying loudly and I think effectively, if you are in a group of any size and you are thinking about getting together, you shouldn't be doing that. It's still legal. He hasn't issued any directive, but he's communicating that so that if that time comes, we will all have been mentally prepared for it.
And we'll talk more later about government help. Allison or Charles, any more thoughts on local government restrictions so far? How that's been working? How it's been handled?
Can you hear me?
Yes, got you, Charles.
Great. My feeling is right now we could be doing worse, but we still need to really at this point, if anything's going to be effective, we have to sort of push more and more how to get people who are not sort of like who are out of work or who are on the streets. We have to completely change our attitude, and we haven't done that enough yet. But I think that for example, I'm of the opinion that right now there should be just not a moratorium on evictions, and even the one that was sort of offered by Inslee, which was like for 30 days, it sounds like too short. Like, what are you talking about? 30 days? It should be something like 6 months. And again, you always like telling people like, don't pussyfoot the situation. I mean, just say flat out moratorium for 6 months, and also to figure out and to push it even further and to figure out ways in which the city can soften, if not completely eliminate, a lot of the economic impact.
Okay, and I'm going to make time later in the show to talk more about government actions and help. Just before we leave the topic of restrictions and compliance and all that, Allison, any more thoughts on that?
No, I mean, I will say that one thing I'm hearing a lot from my community in Capitol Hill, very active, outdoorsy community, is asking a lot of questions about what is allowed and what is responsible as far as taking a walk, being outside. This weather is gorgeous. And so I think that the communication that needs to happen a little bit more is that, yes, you do not need to be trapped 24 hours a day inside, but to do things outside very responsibly, find ways to absolutely not come in contact with anyone else. If you're going to go out to a park or take a hike, you're going to places that you absolutely do not stop for gas. You do not stop for food. You go to a less traveled place where you're not going to be, going shoulder to shoulder with other people. And everybody, whether it's in town or out of town, taking real care not to do anything that might lead to accidents or hospitalization. Now is not the time to, take up bungee jumping, homegrown off off the towers, because this is the time where we need to make sure that we're keeping our healthcare resources where they need to be. But I think it's a really scary prospect for people when they feel like they cannot get outside at all. And I think it's important that people realize that that's not what this means, but there's some very clear guidelines on how to do that responsibly.
Yeah,
And also, could I just say something really quickly? Right now, a lot of people, we're talking about social distancing, and I've been looking at reports coming from Italy, and sort of the picture we are getting is like how really bad the situation is. I mean, we're talking about social distancing, but if you look at the way that it should be handled, this should be complemented with testing as well. And so we're in a situation where we have to do this because basically we don't have a way to manage the crisis by monitoring its spread. We can't even do that right now. And so basically, if you don't do this and you don't do it blindly, meaning like if you don't do it like without, without an idea like what the outcome will be, if we just completely have to commit to it, there's no other way because we do not know who has it and who doesn't. We don't have the capacity to test people in a kind of moment-by-moment situation. As they did say, they were better prepared for this in South Korea. They were clearly not prepared for this in Italy, and that's the path we're heading in. So we don't have much of a choice but to do this at present.
China is reporting no new local coronavirus cases for the second day in a row. Do you believe them?
Yes, I do. I'm not. I think that the issue is not so much. If you look at, I understand if you look at the facts, they should be pretty close to what's going on in South Korea. So it's not. I mean, they of course they kind of. We're in a situation right now where we're receiving this information from usually right-wing sources that say that are trying to push the blame towards China and how it was handled in the first few months. And so now we're asking ourselves, is the information coming out of China dodgy or whatever? But the fact is, we're only saying that now because there's an effort to save or to somewhat hide the embarrassment of the U.S. Approach or response to this crisis, which was completely awful. And so, I mean, I'm sorry, Bill, when you say to be trusted, you're only, in a sense, pushing this right-wing kind of like messaging that we can no longer trust China and therefore we should place the blame on them, which is bizarre if you look at the situation. And again, I want to point this out very quickly.
Yes, DJ.
No, I want to say one really important thing because they're saying that now it's a China virus, but swine flu came out of the USA, and we never called it the U.S. virus. So basically, we got to be careful about how we say, can we trust China? We have to say that in the context of what is going on and how they're kind of restructuring the events that took place early in the development of this crisis.
Okay, DJ?
I got to disagree a little bit, though I do recognize there's clearly an effort in the American political system to frame the lexicon and frame this in various ways. But if we just look at what we know about everywhere in the world, nobody has enough testing, number one. We also know that about 80 to 85% of all of the cases never get confirmed because they're asymptomatic or have very mild symptoms. And we also know that China is very aggressive in terms of information control. So we know those things, I think empirically and broadly, regardless of partisan view. Clearly, they've done a good job in trying to quarantine and get after this after they've misstepped. But my understanding is that they still have two entire regions that are still in lockdown where people are not allowed to leave their homes. And so if that is the case, they clearly still believe there's a threat, and they probably believe there's a threat because they still are seeing people get sick. Okay. So I think it probably amounts to the conclusion that things are getting better, but things are not yet perfect, which would be suggested with zero.
We're going to come back to. We're going to hang on, please. We're going to come back to the Seattle area in a moment. I'm just going to wrap up a few notes here. We're going to take a break, but Washington State confirmed now 1,376 cases, 74 deaths. Restaurants, bars, entertainment, recreational facilities closed till at least the end of March. Gatherings of 50 or more people prohibited. So are gatherings of fewer than 50 people unless they meet CDC criteria for public health and social distancing. No elective surgeries or elective dental procedures, no funerals. Husky students have been packing up their dorm rooms as the UW moves to online-only courses for the whole rest of the school year. Local stores that are open are setting aside certain hours just for shoppers who are 60 years or older or have dangerous medical conditions, so you might look into that. We haven't even touched on the U.S.-Canada border, closed to non-essential travel. Meanwhile, the nation's first vaccine trial got underway this week. This is KUOW's Week in Review. I'm Bill Radke. We're sounding a little different this week because I'm the only one in a radio studio. The rest of my guests are teleconferencing. Charles Mudede, writer at The Stranger. DJ Wilson, publisher and writer at the Washington State Wire. Allison Williams, deputy editor at the Seattle Met magazine. The first coronavirus vaccine trial for humans started this week in Seattle at the Kaiser Permanente Washington Research Institute. The first patient to get the shot was Jennifer Haller, and she told MSNBC about the process.
I do a daily log, temperature and any side effects that I'm feeling. I keep track of those. I, of course, call in if I have any issues. Do a phone call tomorrow, phone call the next day. I'll do weekly follow-ups, and then I'll get a second dose of the vaccine in, I think, about 4 weeks.
Just because the trial is starting, don't expect a vaccine this spring. The director of the National Institute of Allergy and Infectious Diseases, Anthony Fauci, says even in a crisis, vaccines take time.
You must be sure the edict of medicine, first do no harm. So we need to make sure it's safe, and need to make sure it works. That entire process will take at least a year and a half.
DJ, can you give us the basics on why a vaccine takes so long, even in a crisis?
Yeah, it's a good question. If we set aside first whether the vaccine is efficacious, whether it works or not, and the first time you test a vaccine, it's not always the right vaccine, right? It takes some time to get that straight. But once you've got something that works and you want to deliver it to the community, you have to also make sure that it doesn't cause other consequential outcomes. Like it doesn't make people sick with something else. It doesn't hurt them in some meaningful way. And so it takes about 12 to 14 months, I'm told, in our reporting and coverage, to determine that. And so, for instance, if you want to deploy a vaccine early to relatively young people, the data tells us that those people are probably not going to get sick, or rather, if they get sick, they probably will not die from it, though they will get sick. And so giving them a vaccine that might hurt them is really more risk than may be worth it. On the flip side, if you give a vaccine to seniors that are at risk of have a higher fatality rate, about 15% fatality rate of folks 80 years or older, you may save them from one thing, but they may be so fragile that they have potentially fatal consequences or other negative consequences from the vaccine. So you have to make sure it's efficacious, that it works, and then you have to make sure that it doesn't do any harm. And that just takes time to watch and look for the vaccine to play out in an organism. We can move that up, but every moment you move it up, you just have to accept more risk that something might go sideways that we can't see.
That's interesting. That trial patient, Jennifer Haller, says the shot does not put her at risk of coronavirus infection.
This vaccine uses messenger RNA, so it does not use any of the virus. So at no point during this study will she be exposed to the virus.
And Haller talked about something we can all relate to, which is feeling powerless.
We feel, all of us, I know we feel so helpless, like what can we do? And I am so excited that there was actually something that I could do, and I did it, and I'm doing it.
And Kaiser is still recruiting volunteers, by the way. You can apply if you want to, corona.kpwashingtonresearch.org. And Allison, you were telling us about some other things people can do, including sewing a mask.
Well, I think right now, the sort of powerlessness thing that she was talking about is so true. One thing I've seen is some healthcare workers talking about needs for masks and actually headwear as well, like surgical caps. These are not sort of high tech protections, but they're things that might be sewn by the general public. I know that there was a designer in New York who's offering to make some as well. And I believe a hospital here that's giving out kits for people to sew these masks. And these are things that can be maybe reused, or maybe they can be used in situations where those N95 masks aren't required, and so we can save the higher level gear for coronavirus situations. So I think you can look around, you can find some of these things on the internet. Are they, are they going to turn the tide of us sitting home and sewing our own medical equipment? Probably not, but it's a chance, I think, for the community to recognize that whether it's taking part in a vaccine trial or trying to build supplies, or heck, just sending pizzas to a hospital for the healthcare workers. These kind of things sort of keep a community focused on the mass effort, and keep us from sort of holding away and falling into sort of our own little pits of despair.
Yeah, there's a drop in blood donations. I gave blood this week. It was very reassuring and socially distant and all that kind of stuff. There's a team in Italy 3D printing respirator parts. And of course, the big deal here is that our health system just doesn't have enough, beds and equipment, ventilators, respirators, all kinds of stuff that we're vials, swabs that we're running short of. Yes, so
and trained doctors.
No, you guys. There's something also that has to be really stressed to the public. This is not like a situation in the movie Outbreak, right? You have to sort of break with that kind of notion that what we're trying to do is find a solution or a cure right away. This is not what we're doing at this moment. What's happening right now is basically we're not even thinking about getting rid of the virus or something like this. What we're trying to do is to slow it down so that we are ahead of it, so that the disease doesn't overwhelm our health system. We're trying to buy time to build a health system that can cope with the current situation. This is what's at stake right now. If we don't see it that way, I mean, it's the vaccine and all these things take months to develop. The ventilators and all this stuff is going to take a while to get together. But right now, what everybody has to understand is that we're behind all of this, and the only way we can get any kind of progress ahead of it is if we slow the disease and the progress down. And so to me, it's great to hear all this stuff, but understand this is not where the battle is taking place. We're fighting to buy time to make the kinds of institutions and the kinds of drugs and the kind of policies that can in the future respond appropriately to the situation. And that's where we are. Thanks. And so.
We're going to come back in a moment, and we're going to talk about economic pain and job losses and government help, including the Washington State Legislature, and even some reasons to smile when we continue on the Week in Review. We're getting through this together. Stay tuned. You're listening to the Week in Review on KUOW Seattle. I'm Bill Radke. We are all being socially distant these days, and we're doing that too on the Week in Review, which is why you can hear that my guests are not sitting in the studio with me this time around. We have DJ Wilson, publisher and writer at the Washington State Wire and State of Reform. We have Charles Mudede, a writer from The Stranger. We have Allison Williams, deputy editor at Seattle Met Magazine. We're talking, of course, about coronavirus. Congress has approved a relief package of paid leave, enhanced unemployment benefits, food and health care aid, free testing, and that'll cost some hundreds of billions of dollars. The Trump administration has asked Congress for another $500 billion for direct payments to taxpayers and $500 billion in loans to businesses. We've been talking about a variety of financial aid, unemployment benefits, et cetera. DJ, what has our state legislature done about coronavirus?
Well, this hit near the end of the 60-day session. So it's probably a good thing. At places like California, the legislature there is basically recessed and may or may not come back into session at all. So on one hand, they got in, they got out, they didn't linger. I think that's a benefit for everybody. At the beginning of this process, when the House and Senate released their initial operating budgets, these were the one-year supplemental budgets that roll into the two-year biennial budget. At the beginning, they had, one side had $5 million, one side had $10 million for the coronavirus. Those are mostly to fund call center operations that were getting stood up and expanded by the Department of Health. And those, were essentially what we knew in late February, early March. But then it really started to ratchet up. And there was a bipartisan bill that was considered 2 Mondays ago by Eileen Cody, a Democrat from West Seattle, and Joe Schmick, a Republican from Eastern Washington, sort of southeastern Washington, that would have added 50 million, so a 5 or 10-fold increase. Then it was 100 million that was finally adopted in the budget. And then on the last night of the session here last Thursday, they bumped it up again to 200 million, which is significant, very rapid response. I think the governor repeatedly thanks both Republican leaders in the House and the Senate for their bipartisan engagement and leading with Democratic members as well. But it was important in his press conference Wednesday, I think, or Thursday, Wednesday, I believe. The governor said that they had already spent 75 million of that 200 million, as they are very rapidly trying to respond, including things like grants that can go straight to small businesses and including expanding unemployment and doing things like waiving 1 week time delays before people can file. So it's very possible that we'll have a special legislative session relatively soon where we appropriate even more money to get through this.
Yeah, to give you a sense of the what's at stake here, about 40% of the 2 million jobs in King, Pierce, and Snohomish counties are likely to see wage reductions or temporary layoffs, according to a study out this week commissioned by the Seattle Chamber of Commerce. More than 400,000 workers fall under the immediate risk category, including retail salespeople, cooks, waiters and waitresses, cashiers, dishwashers, bartenders, and stock clerks, mostly people that make $15 to $25 an hour. I spoke this week to a waitress, Carrie Wason, who used to work at the Tom Douglas-owned restaurant Serious Pie before she got laid off last week.
Like minutes before we got the information, I was having a conversation with a coworker about how we felt confused and scared, but that we felt grateful to be working for particularly this company, which we were sure would never shut down because it's such a big deal. Tom Douglas is a big deal chef in Seattle.
Tom Douglas is still doing some takeout and delivery business, as restaurants are allowed to do. State and local governments are freeing up financial aid, residential evictions on hold, utilities are not shutting off water and gas and electricity for non-payment. Allison, any thoughts on how well the government can get to all the people who might go hungry or cold because of this crisis?
Well, I think right now you're just looking at a twofold issue. You have an immediate need. I mean, I think we were hearing from people that trying to apply for unemployment, the servers were just absolutely shutting down. There's so many people looking for immediate help right now. And that's coming, some from the government. It's also coming a lot from private sources. I'm seeing groups getting together to support different industries, trying to give sort of immediate financial help. And that's incredibly important, but there's also a long-term effect that we're looking at. I know I was talking to a young woman who was laid off from a theater group where she worked, and she is an actor and as well as a staffer at this theater group. And she said, for one thing, nobody was really complaining about the fact they understand why it's necessary for the theaters to close, but they're also wondering if their industry is ever going to be coming back. They're not expecting a theater, an arts organization can't shut down for 2 months and then pick up and rehire workers immediately. So she, is suddenly looking at an industry that might not exist for a year or two or more. And so I think that as we look at relief, it's incredibly important to go to the immediate needs as well as start thinking about how to rebuild some of those industries long term.
I was talking with Seattle Mayor Jenny Durkin about how this virus affects the city's policy of taking down homeless encampments.
From the minute we had our first positive case, we shifted our priorities to go away from the 72-hour camp relocations to having the navigation team do outreach to inform people about the dangers and hazards and presence of COVID and to hand out hygiene kits. And we've been doing that since I've declared the emergency. On the obstruction work, our communication was not as good as it should have been with the frontline workers, but there too, we have really been focusing on those obstructions that present a public safety threat to the people.
She says the city cannot allow generators that create a fire risk, and we have a couple of dozen firefighters out in quarantine because of coronavirus exposure. So we're just running through some of the issues, short-term, long-term, acute, and more big picture industrial implications. It's just sort of mind-boggling. I think, Charles, you were trying to chime in earlier.
Yeah. I'm sorry. There's a lot to think about, and I just want to. I know we've handled the homeless situation so badly, and now it's like it's so late and so little. So I'm going to say that, but I want to move on and make another statement. Right now, in terms of like the local economy, in terms of people in restaurants and in the art community, and also just other economic sectors, business sectors, we are dealing with a recession in real time. So basically, we have been in a recession since about the beginning of March, and the unemployment numbers are going to come out, and they're going to be stark, right? What we're not really talking about is there's another big recession coming our way. The stock markets right now are still crashing. They're down about 6%. What is it? About 600 points today. A low is about 3%. So it's completely unfolding. We have not experienced that impact yet. And so basically, we're going to end up somewhere around August with coming out of this with a lot of unemployed people, a lot of an increase in homelessness as a consequence, and another big shock to the system, which is going to be arriving via the collapse of the equity markets in New York and also probably around the world. So I'm sorry to be so dire, because if we're not saying what's coming up, if we're not being honest about what the situation is, we will not be prepared. And I don't think Inslee and I don't think the programs and the packages they're talking about right now are adequate to what we're about to face, which is, for the first time, a dual recession. I mean, on both ends, Main Street, the city, and also one that was sparked with market crashes that began with the market crashing around the world, and particularly in New York City.
And I want to sort of amplify some of what Charles is saying with some data. The report out of JP Morgan earlier this week suggested that in the first quarter, meaning the quarter that we are currently in, the annualized rate of growth will actually be a negative 2%, that we will then roll into Q2, April through June, and Q2 will have a negative 3% annualized growth rate. So those two quarters together are the definition of a recession. To Charles' point, we're in the middle of one now. And Seattle's a little, not counter-cyclical to the rest of the country, but we're just on a little different cycle. In this case, we have kind of a funky thing that's happening because we are leading it. Usually we're a lagging economic market, but now we're leading it. And Inslee had suggested or said earlier this week that unemployment filings for new jobless claims are up 150%. They are spiking across the country. Goldman Sachs projects that next week we'll have a 2.2 million number in terms of new jobless claims, which is higher than the Great Recession, higher than .com, higher than 9/11, higher than the recession of 1992, and so it's a magnitude greater than we are used to. And even if we have a relatively flatter curve in our population of folks who are infected here, we will still likely, based on the data, have a healthcare and hospital system that is totally overwhelmed by magnitudes. And even if we are in a better place and we get through this more quickly, in a best case scenario, the rest of the country is still going to be suffering. And so we're going to be living in that, to Charles' point, we're going to be living in that credit market, that equity market disaster that is looming. So I think it's actually the thing I watch on this question of financing is less about the equity market, because I think there's a lot of equity out there and there's a lot of big money that can handle themselves. I'm much more interested in the credit market, and when people can no longer purchase things on credit cards, when their home equity lines of credit are called in and called due and not allowed to be expanded, when banks begin to limit the amount of money that you can take out in cash, which those of us who are Gen Xers, the latchkey kids we talked about earlier, we remember that happened when Washington Mutual was collapsing 10 years ago. Couldn't take out very much cash. So that is the thing that's going to really be striking. To again, sort of to refine Charles' point, we have both a supply side collapse, meaning production is getting crushed because we are a global economy. China does source a lot of our manufacturing goods and primary materials. And we have this demand side crash, meaning people don't have cash and they don't want to go spend money. If you ask me, would I buy a ticket to go to Disneyland if I could? I can't go to Disneyland because it's closed. But if I could, would I go for $1? And the answer would be no. I won't pay $1 to take my kids to go to Disneyland because there's no discount you can give me. That's the demand side crash. And when that happens, which is what we're seeing, that is cataclysmic in a way that we are not prepared for on a regulatory, social safety net sort of way. Just a last point on this. I don't want to drone on. I'm sorry, but I'll say, if we look at other countries and how they are responding, Italy, France, other OECD developed countries are doing something interesting, and they are postponing payments for things like utilities, payments for things like mortgages. So if you have debt, if you have a home mortgage and you don't have any money because you can't pay your bills because you lost your job, you still have to pay that money in time, but you don't have to pay it this month and you don't have to pay it next month. So we probably do need to get much more creative and much more aggressive, because when we look back even on the decision to close down the schools, days before that decision was made, we sort of said to one another as a community, boy, that would seem drastic. And now we look back on that decision and we say, that wasn't drastic, that was just step one.
Yeah. Hey, Charles.
By the way, Bill, that was my biggest piece this week that I wrote. I wrote a piece about how we should actually right now cancel or put on a moratorium debts and rent and also mortgages. Realistically, that we should actually say, if we're going to be serious about this and addressing it, we should be talking about 6 to 12 months, and say that they will have to be readjusted, or some other program will have to be set up in the future. But right now, if you're not looking at this in that way, you're not being very realistic. And I do agree with Wilson on this point. We're not really looking at what's coming our way. It's when I say when Inslee says a 30-day moratorium on eviction, you almost want to laugh and like, no, actually, what you want to do is to say bills and all these things, credit cards, and all these things have to be frozen while we try to figure out how to move forward.
Can we end on some reasons for hope or even to smile?
Yeah.
Yeah. Anybody?
Absolutely.
Anybody?
We got a chance to remake the world. This is a good. No, seriously. What's really fascinating is, for the first time, people are going to see why we should not ignore scientists. You know what I mean? We've been living in this dream world for a long time about, is carbon doing a problem? Is the environment really that bad? Scientists say weather events are going to get worse. We've been living with this popular denial as a part of our popular political discourse. I'm really excited because I think people will start to see that kind of denialism is actually driven by economic interests primarily, in a way that we could not have done. we never had a way to say, listen to scientists in a very apparent, in a very obvious way. And you might say, no. The situation is going to get really bad in the USA. The hospitals are going to be overwhelmed, and particularly in states that ignored all the information coming from scientists, they're going to finally get really crunched by this crisis. And now, at this point, we can actually say, if you think that's bad, let's talk about climate change. And that to me gives me hope.
Okay.
Like, thank you, virus.
Yes.
Thank you. You might have actually saved humanity.
Allison, are you excited about anything, or at least hopeful, or at least smiling wanly?
As I sit here, my dog just came up and put his head in my lap, so I think he could tell that I needed a little hello.
Mm-hmm.
But also, I'm seeing people be just really deliberate about reaching out to each other. I'm seeing people thinking about their connection to other people in their community, and I think that gives me hope that people are realizing how important we are to each other and how interconnected we are, and that can be something to take from this.
We have started meeting on our street in a socially distanced appropriate way. We literally take out the tape measure and we put down blue tape. We mark 6 feet apart, and we get together and we have a weekly meeting. We've done the last 2 weeks with about 12, 15 of us.
Tape measure party.
Yeah. Who knew it could be so fun? And we just talk, and we're talking with neighbors that I've never really talked with before, frankly.
Well,
I'm building community in my community.
Yes.
And that is, and what we're seeing, for instance, is some of the seniors on our street are giving tasks to some of our kids. So there's this like intergenerational communication that's happening that would never happen before. So, for example, one group of seniors has asked some kids to do an art project for them and then to deliver it on their doorstep, and they will get a reward. And that the seniors want to see it, and the kids are excited about the art. That's great. And we're able to come together, because here's the other thing that we have to recognize is that if the hospital system, the hospital system gets overwhelmed, we don't want to send sick people to the hospitals. We have to take care of them on our street. And so the Gen Xers, will be taking care of the seniors, and we should, and we want to. So I think the upside for us is that we're getting to know people who are going to support us on our community in a meaningful way that will transcend this moment, and we will be better off for it because of this time.
Yeah, there are those community connections. There's a kind of resilience that I hope my kids maybe have that maybe even I didn't, because I didn't go through the blitz or what have you. But they're seeing that they don't even in their relatively cushy situation, they don't have guarantees of health and calm and all that kind of stuff. And then of course there is the pleasure of watching videos of zoo animals running around the grounds with no visitors there. I recommend the Woodland Park Zoo's got a YouTube channel up with the porcupine watching the penguins swim, or the Shedd Aquarium in Chicago's got a penguin watching swimming fish, and just in general, even hearing about Allison's dog saying hello feels good. Maybe not videos of bats right now, too soon, but other than that. There's some good stuff out there.
A friend of mine who is a writer, she's a mom and lives in Italy, wrote this piece about what it's like as a mom in Italy. And one of the things she said was, like, forget about your worry, parents, about screen time. Like, let some of this stuff go. If your kids get an extra hour of TV, that's fine. You know what? Because they are internalizing this in ways that we won't see directly, maybe for some time. My daughter's up till 2 or 3 every night because she just goes to bed and she can't stop thinking about this stuff. And so we just have to lead with a little more empathy and a little more love as parents, because our kids are watching and they're going to take this moment with them for the rest of their lives, just like to your point, Bill. And this is not going to be the last time in their lives, or probably ours, that we have a major setback like this. So how we act now will be effectively writing the playbook for the next time this happens.
Yeah, and also, I want to say one last thing is, and I know we were going to talk about this, and I know we're running out of time, but don't give $60 billion to Boeing. You should ask them, where did their money go? And they will say, and they'll have to say, we spent it on buybacks. That's another topic. I'm sorry, I had to bring it out there. I'm that kind of guy.
Welcome to do it. All that's on the table. I'm going to play a song for you. Anybody want to give thoughts, final thoughts, or things I haven't asked you about?
A friend of mine used to say, there is no survival value in pessimism. And I think we should remember that. The people who listen to KUOW are smart, they're thoughtful, they often are creative, and they're problem solvers. And in this information age where information overload can send us into real sadness and periods of anxiety and depression, there is no survival value in pessimism. The only way we get through this is through optimism and creativity. I think that should be our focus.
On realism. And realism says this: the markets aren't bouncing back when this is over. People don't buy that for 1 minute. I'm just going to have to keep making these points.
Yes.
Be realistic. Don't be pessimistic. Be realistic.
Be realistic. If you are a creative problem solver, as DJ said, call us at KUOW and we'll air your story of creative problem solving. So our voicemail number is 206-221-3663, 221-3663. Here's a reminder of how to think and behave, written and produced by the podcast team of Today Explained.
You need to stay 6 feet away, 6 feet away.
I'm more than 6 feet away from Allison Williams from Seattle Met Magazine, Charles Mudede at The Stranger, DJ Wilson of Washington State Wire and State of Reform. Hey, thanks everybody for doing this remotely this week. We appreciate it.
Thank you.
Your work is very important and very meaningful, Bill. Everybody appreciates it. Thank you.
And thank you to your dog, Allison.
Thank you, Bill.
Need to stay 6 feet away, 6 feet away.
Our show's produced by Allison Bruzek. Thanks for tuning in, and we'll talk again next week. We'll get through this together.
6 feet away, 6 feet away.
Hi, this is Bill Radke, host of KUOW's The Record and Week in Review. And I'm here at work. I'm not working from home. I'm working from work because this is where we broadcast. And we decided that bringing you breaking news, answering your questions, talking to your leaders at a time like this during this virus outbreak, that's an essential service. You rely on us, and we want to be here for you. I'm letting you know that it takes not just people, but money as well to cover breaking news for producers and engineers, and these days bringing in safe food and disinfectant and all that, on top of the costs we already have, equipment and paying for network programming and all that, what you hear about at the pledge drive. I'm asking, would you please take a moment and donate something to KUOW? Give a little money so we can keep local independent journalism on the free airwaves. You rely on us. We'll be here for you. Thank you so much for your help.